Hello and welcome to On Point. I'm Herrera. Today we are here to discuss the rise of syphilis. Syphilis is a disease that most people associated with the past. In fact, doctors had all but eradicated it 25 years ago. But now, public health experts say syphilis is back. It's a highly contagious, sexually transmitted bacterial disease. The infection can also be spread from an infected mother to her unborn baby. Syphilis can be treated with the right antibiotic, however, without treatment. It may lead to brain damage, paralysis, blindness, and death. The AIDS Healthcare Foundation is an organization spreading awareness of AIDS and STDs. The AHF recently launched an outdoor advertising campaign to educate people about the syphilis tsunami. The billboards popped up around Los Angeles and other cities in an effort to bring attention to the rising rate of syphilis in the U.S. The Centers for Disease Control and Prevention report an estimated 33% increase in syphilis cases from 2014 to 2016. California has the third highest syphilis rates in the nation and the nation's second highest rates of congenital syphilis. Health officials say the causes are many: a decrease in condom use, a lack of awareness among patients, and a falling number of STD clinics. We spoke to a few students here on CSUN's campus. This is what they had to say.
I have no idea what syphilis is. I know that it's an STD, I think. Honestly, I don't talk about STDs to my friends because we've never had any. So, for somebody else to come up to us to talk about it, I would pay attention because I know that's a serious issue. It's not like something you joke around or anything.
If it doesn't affect you, why would you basically care? Unless it did, and then you want to be more educated about it. So the whole point is to do prevention methods. That's the whole point before even actually happening.
AHF President Michael Weinstein says the public needs to be aware of syphilis and encouraged to get tested for STDs. On Point's Nathan Hoffman has more on the story.
Thank you, Shawandi. Welcome to On Point. My name is Nathan Hoffman. Today, I'm joined by Keyari Badon. He works for the AHF and is a community disease intervention specialist. We're also joined by Johnny Cross. He works for the Los Angeles LGBT Center and is a syphilis specialist. We'll start with Johnny. What are a few reasons why syphilis has reemerged as a prominent public health threat, and how is it passed from one person to another?
So the first part of your question, it's not exactly easy to answer why it's come back. We do know in the past 20 years or so that we've seen a large resurgence, mostly in the LGBT community and the gay men especially. In, I believe, 1999, 2000, there was under 100 cases in California, and since then it's been rising steadily. As to why, I don't really have an answer for why. There's multiple reasons that it could be. The second part of your question, can you repeat that again?
Of course. How is syphilis passed from one person to the next?
Okay, that one I can answer a lot easier.
Okay.
The first symptom of syphilis is an open sore, and when you come in contact with that sore, that's how it gets spread from one person to another. So a lot of times someone will have the sore in their mouth, around their genitals, and all it takes is contact with that sore to go from one person to the next. So it's very easy to pass. Even if you're using condoms, if the condom's not covering the sore itself, you can pass it. If someone has a sore inside their mouth and they don't realize it's an STD, it does present as a painless open sore, and they're performing oral sex. That's direct contact, and that would be a way to pass it as well, and a lot of people wouldn't have any idea they're passing it.
Okay. We almost eradicated this disease in the past, and it's made a resurgence. Why were we able to get so close to getting rid of it? And why don't those same strategies work today? And we can start with Keyari.
Just like I think regarding with the first question, it's a pretty broad, that can be a pretty broad answer. For one, it could be maybe due to lack of medication, or as you know with the human body, when you're on antibiotics, some people actually become immune to that. So it could be maybe earlier on we didn't have as much knowledge about syphilis, and maybe the treatment that we were given maybe was insufficient, or maybe it contributes to lack of education. Maybe we had providers misdiagnosing, or maybe people just don't know about it. If you had a rash, you didn't go to the doctor. Maybe the doctor thought it was eczema or something, I don't know. Which it does look different, but it could be, I think mostly, maybe lack of education, or just the progressive of the bacteria itself. Yeah.
Okay. As we saw earlier in the show, we spoke to students, and it seems that college student awareness about what syphilis is and how it's spreading and all things about it is relatively low. How do you think our education system when raising people and young adults has affected this? And we'll start with Johnny, and then Keyari can follow up.
Yeah, we absolutely need more education to youth especially. We do a lot of educating at the LA LGBT Center. Our main focus is keeping people healthy, and a big part of that is prevention and education. So yes, I strongly advocate for more education to youth. I talk about syphilis a lot here at CSUN for some of my projects in class, and it's interesting to me too how many people are surprised or learn new information, and we're college students. So yeah, I think we need a lot more education, especially targeted towards youth.
Keyari?
I definitely agree. I would say that one valuable tool would be marketing. I think that when you're trying to reach millennials, you have to use social media. You have to be able to speak basically their language, in the sense that now we're just so tech savvy. So I think one thing I can honestly say with most organizations is that we found a way to, whether it's maybe create an Instagram account for HIV STD information, as well as free treatment and testing. So this way it allows, if I'm scrolling through my Instagram, if I'm paying for those ads, I see that, because people spend the majority of their time on Instagram. It's just same as with Facebook. I think it's just, again, reaching out to millennials. And so far, I mean, this syphilis tsunami billboard resonated well with millennials. So I think that's keeping that momentum could definitely provide more education. Will provide more education.
And off of that too, I think educating stigma, that's what you just reminded me of when you're saying that, is just by educating alone, you're reducing the stigma attached to it, which should help everyone, feel more comfortable, talking about it, getting tested, and knowing how it is spread and how you get it.
Johnny, you work as an investigator to actually find people with syphilis. What is the process of actually finding someone with syphilis when they don't even know they have it?
So there's multiple ways we can do it. Keyari probably has a lot of stories in this as well. The easiest way is going to be through a phone call. If someone has a phone number, we can call somebody. Usually it's a very basic message. We'll just let them know, hi, I'm calling from so-and-so, or I'm calling from this location. Somebody came in here and had tested positive for such and such. When that happens, we want to make sure the community is safe, so we ask them if they'll allow us to notify partners. They mentioned you're someone who may have been exposed. And then from there, usually by the way we're phrasing it, they understand that we're not going to tell them who it was, but we're just trying to get the education out there. So that's one way we do it. And the more we've done it, the more people hang up with a thank you. Some people can be agitated at first, but if you're doing the messaging right, everyone usually understands what we're doing and they're not shooting the messenger. Other ways to do it would be if someone tells us that they've been to a house or a place where maybe there's like a sex party going on and we can find multiple people, we'll actually try and go to the house if we can and talk to someone or leave a letter if we have to. Or just that's a big situation, but if someone just says, I was at this one person's house and they know where it is, we can go there and try and talk to the person as well. Texting, we can use Facebook to try and find people. We can't message through Facebook for legality reasons, but we can use it to try and find people and match up networks and friends and try and find partners that way as well.
Keyari, when you speak to somebody and you're informing them that they may have syphilis or that they do have syphilis, how do those conversations usually go?
It depends. So you may get, there's a certain group of people that feels like it's a sales call or someone's pulling a prank on them or whatever. But we really try to be assertive, I think, because if I'm calling, granted, I want to be friendly, I want to be nice, provide great customer services to you, but at the same time, this is a serious issue. So with my team, what we do, we really focus on being assertive and just letting the person hear our tone and understanding the severity of this bacteria and what it could possibly do to the body if you are not receiving treatment or adequate treatment. So usually it's just, it depends, again, on the person. When we are vibing with them, maybe if they're really concerned about their health, they will ask you, follow up, okay, well, where can I go get treatment? And we provide that information to them as well.
Right. For the viewers out there who aren't aware of what some of the symptoms are and what exactly could cause syphilis in the first place, could we just go over that real quick? And afterwards, what happens if you don't receive treatment? And we'll start with Johnny.
So as I was saying earlier, the first symptom of syphilis is an open sore, and that's usually how it's going to be spread. That shows up during the first 3 months of when you've come in contact with it. That is also the window period. So during that time when the first sore shows up, you might not test positive on a test. And a lot of people don't notice that sore. It is painless. And like I said, if it's in someone's mouth, it does heal on its own, so they might not realize it's an STD. It could be inside their anus, inside the vagina, and it's painless. So if it's there, you're not going to know it's there. But if you're having unprotected sex in those places, you're going to be passing it. After that, that will go away on its own. Secondary symptoms are usually red spots, rashes, could be patches of hair loss. Usually the most general one we're going to see is the red spots, a lot of times on the palms or on the bottom of the feet. Those show up during the first 6.5 months of coming in contact with syphilis. That also goes away on its own. After the second stage, it goes into a latency for a while, and it usually doesn't come back. Well, the time period is different for everyone, but it can resurge then as neurosyphilis, which gets into your spine, your brain, and that's when it starts really causing major damage. It causes dementia, blindness, deafness, and eventually death for some people. Which is why it's so important that Keyari and I do what we do. We try and contact people who don't know they may have been exposed to this thing, so we can make sure they don't get to that later consequences.
The current White House has made a commitment to more or less try and repeal Obamacare, and the results of that would remove many people from health insurance. It would also cut Medicaid funding, and how would that affect how we treat syphilis and other STIs if we don't have the funding to research new ways to treat it, and if we don't have people on health insurance? Keyari, we'll start with you.
I mean, well, basically it will contribute to the growth, the spread of infection. So if like right now, so we provide free treatment as well as testing, the LGBT Center as well as AHF. So if any funding was cut within that arena, whether it was regarding to HIV testing or whatever, or the Ryan White, then it would affect how much we will be able to provide to the community as well. I think that the reason why we're able to have so many people come to our clinics is because we have free treatment, we provide free testing, and it's also, again, with the environment. If I'm going to my primary doctor, a general HIV STD test result can cost me anywhere to $200 to $300. And that's just for testing. That's not including treatment if you need it. But if you come to us, everything is free. So if that was being cut, you have no insurance, you have basically no clinics that's going to offer you free testing, and what's basically going to happen is people will end where he mentioned the latent stage, that once they enter that stage, I mean, granted, they may not be no longer contagious at that point, but it becomes more detrimental to the body. So you do start developing like ocular syphilis and things like that. That will, again, eventually may even cause death to that point. So I think when it comes to just the funding with HIV and STDs, it's really important that we continue to pressure the government about why it's important that we have this. Because right now, I mean, you have millennials who are being diagnosed with HIV as well as syphilis, but when we're interviewing them, they're very ignorant just to that subject, so they don't really know a lot about it. Or if I explain to them or disclose to them, like, oh, you just tested, the HIV test result tested reactive for antibodies, they usually have a blank stare like, okay, so what does that mean? Am I going to die? Or can we go get treatment? What do I need to do? But yeah, I think if we take that away, you're also going to take away the education part as well.
Yeah, it's a scary time we're in. I mean, I feel the same way. Because I work at a nonprofit, people have asked me, are you worried that you're going to lose your job, or people are going to be losing jobs with, whatever is going to be happening politically? And the way I phrase it is, if the ACA or any of these health protections get taken away, it's not that we'll probably lose our jobs, but we'll lose our jobs because we're not serving the patients anymore. And where are they going? So and that really seems to hit it, when we say it that way, is it's not about us, I can find a job. We're losing our jobs because the patients can't come to us anymore.
How does our healthcare system compare to that of foreign countries when it comes to treating STIs and STDs? Places like Canada or London or France with universal healthcare. How do they handle it differently?
I don't have much knowledge, sorry about that. I
mean, I don't have much knowledge, but depending, again, that depends on what type of insurance policy or plan that you may have. I know that within the USA, we have the ability to provide free treatment and testing. I'm not sure. You see organizations like from the USA going to foreign countries and also providing assistance to those countries, like for testing and treatment. So obviously there's a lack of care there, but as far as the insurance plan or policy, I'm not familiar neither.
Okay. Pfizer is a pharmaceutical company and it's the third largest in the world. It also has the exclusive patent on the primary medication for syphilis, yet they often report that they have a shortage of the medicine. Why is it that they report having a shortage, and how does that affect how we treat people with syphilis? Johnny, start with you.
Mm-hmm. So I can take the second part for sure. It affects how we treat people because the alternative would be doxycycline, which is oral pills that you take a couple times a day for 14 or 28 days. And the worry about that is adherence. So if someone doesn't take the medication properly, they could keep spreading syphilis or turn into neurosyphilis. The reasons for the bicillin shortage, that I think is very political as well. More money needs to be going into STD prevention funding. Federal prevention STD funding has been flat for 20 years, and STD rates have been rising for 20 years. So something needs to change. And on the same topic, gonorrhea, there's resistance forming to those medications as well. There needs to be more money put into that as well.
Just to add on that. So again, that is a very political question, but in regards to it, I think it's easy when you first hear that question, you want to blame Pfizer for it, right? Because they have the patent on the final drug. But in the bigger picture, there's other manufacturers behind it that the API, the active pharmaceutical ingredient for the bicillin is not actually included. Pfizer doesn't actually have a patent on that. So what happens is they have to get that ingredient, and then once they go through the chemist or whatever, they create the medication, the antibiotic for it, that's when they're able to patent the final drug. So a number of things could play to that. Maybe the manufacturers are not sending them the API, for the ingredient to complete the bicillin treatment, or it could also, again, be due to you mentioned the increase, right? So it also, again, go back to lack of education as well. If people are not informed about it, or maybe they're not conducting a proper audit. Mostly because what happens is providers will overtreat clients, but I'm not going to say that's like the main part of it or the main reason why, but you kind of have a broad spectrum of different reasons, I guess you can say.
You just said something made me think of too. The shortage is overtreatment.
Yeah.
Because of our healthcare system, the way syphilis is tested is you have to always, if you've had it before, you have to compare your test to the last test and look at that ratio to realize if it's a new infection or not. So if someone's coming from one clinic to another and you don't have that information, the doctor might choose to just give them all 3 shots, which is the most treatment you'd get for for an early case of syphilis. And that could be also why there's a shortage. If we had some sort of system, where you could track somebody's history, you would know this is not a new infection. They don't need treatment. Where some, providers are treating rather than, ask the person to come back in a few months and test again, and then find out they actually did have it. So they'd rather just treat to begin with than, have a question there.
Okay. With congenital syphilis, it's possible for a mother to pass syphilis onto an unborn child. How does this affect the life of that unborn child once they are born?
A child could potentially be blind, depending on how severe it is, or maybe even cause death as well. But going back to that, now that you bring that up, when we talk about the shortage of penicillin treatment, again, if hospitals are short of penicillin and a mother is actually pregnant and she has syphilis, if they're not able to provide her treatment right then, the child will be infected at that point. And you're, again, talking about other detrimental issues that may cause harm.
Do you think that a rise in hookup apps like Tinder and Grindr is to blame at all for a rise in syphilis? And are there any groups of people out there that are more prone to contracting the disease than others? Let's start with Johnny.
So, I mean, the websites, I think people are always going to find a way to make networks and find other people to have sex with. So I'm not so sure if those are reasons. I mean, sure, they could add to it, but I don't know for sure. I think if those websites didn't exist, people would still be getting syphilis and spreading it. And I'm sorry, I can't remember the second part of the question.
It's okay. Are there any groups that are more prone than others?
Yeah, so youth for sure, and then so men who have sex with men, or gay men, were a disproportionate of the number of syphilis cases we find. Youth, and then Black and Latino men also, we're seeing much higher numbers. So again, there's a lot of effort on education in those in like younger youth.
Yeah. Does funding in certain neighborhoods play a part in that as well? Like, would you say that in a more well-off neighborhood, the likelihood of syphilis spreading is lower or higher than a lower income area? Keyari?
Oh, that's a good question. You do see more marketing within the, I guess you can say the urban areas or just low-income areas, let's just say that, than you would see maybe in Beverly Hills. But granted, there are still billboards. I think when you're looking at the heart of let's just use LA for instance. When you're looking at the heart of it and you have Hollywood, pretty much everyone passes through Hollywood, right? So you have billboards that actually speak about awareness and prevention. So yeah.
Okay. When we talk about stigmas regarding STIs and STDs, a lot of people tend to shy away from them, and it might make them afraid to talk about it or even go get tested. What are some stigmas that if you could just send a message to people out there that you would want to dispel for them? Johnny?
Sex is messy. It's the nature of it. You know, it's a human, it's something we all do, and it's nothing to be embarrassed about. Sure, no one wants an STD, but it comes with the territory, and really the best thing you can do is be responsible about it, get yourself checked, get your partners checked, and move on. The stigma attached to it, it does a lot of harm, and if we could find a way to remove that, I think we could get a lot more people tested and talking about it, and yeah.
Keyari?
As far as stigma, I agree with Johnny on this. Being able to, I think it's more so about accepting responsibility that if you are going to have sex with multiple partners, or maybe you're just in a monogamous relationship, the conversation should start somewhere, preferably in the beginning, because that's where it's most effective, I would think. But you definitely want to keep the conversation going. I think within certain communities it's kind of taboo to some of us, but once you understand that this is reality, this is what's going on, you owe it to yourself to be responsible, to go, even if you're not sexually active, just go to the clinic and see how it is, experience that, how it is getting tested. So maybe when you meet someone, you'll be able to ask, hey, start the conversation with them about it, and who knows, maybe I can go to the clinic and get treated together. I think it should just be looked at something that's more definitely a priority. But again, it's just about being responsible, and then once we educate ourselves, we can educate others about it, and I think that's one of the most effective ways to help decrease it.
I think we look to ourselves to remove stigma in our jobs a lot.
Yeah.
Like I said, when we are on the phone with someone, a lot of times they might be anxious or aggressive, but usually by the end of the conversation, that changes. And I think a lot of that is because we're calling them and saying, it's not the person didn't want to tell you themselves, it's that we asked them to allow us to do this so we can explain how it spread, we can set you up an appointment, and then if they are to test positive, we're going to try and get to their network of sexual partners as well.
Yeah, and we really do keep a non-judgmental zone. So you have clients who may be a little shy or embarrassed to say, I had such and such number of partners within maybe 3 months. And then, you sense that and they're like really embarrassed, but then we just let them know, it's completely normal, you're fine. We're not judging. You should feel comfortable when you walk in here and talking with us, because that's the only way you're really going to be able to get through to them and build some type of rapport, and hoping that they learn something when they leave that clinic, and maybe they can pass that information on to maybe their friends and get them to come back.
Yeah, turn the embarrassment into empowerment.
And this question is to both of you. If you could change one thing about how we treat STIs, both socially and medically, what would it be? Start with Johnny.
So you say treat, you mean like the way our attitudes towards them, or you mean
attitudes, and if you could change something about how people come in and deal with STIs and get treated for it.
I guess just any way to remove barriers from care. There's a lot of barriers to care. The stigmas are one of them. They're afraid they might not have the insurance that would cover them to go places. They don't know where they can go. So I think removing those things, any way we could find a way to get just easier, accessible healthcare for people, I would say that would be the number one way, in my opinion, to try and bring these numbers down.
Keyari?
And you mentioned treatment, right? How
Yes.
could we change to go about that?
Right.
I think it's just more so with providers. well, not even just providers, clinicians or people, those of us that work in the public health sector, we definitely should make it a priority to maybe double check if a patient needs treatment or not. I don't know as far as like when you mean changing treatment, because with syphilis, like we just got an update regarding secondary syphilis. So that kind of changes. It changes as it progresses or goes on. But I don't know if I would necessarily change, like have any recommendations for us to what type of treatment, but more so as providing treatment, like the experience when you go to a clinic or a hospital, and making sure that the doctor is being responsible and looking at the titers and following up, which is a lot of times where we come in, because maybe a provider only has one syphilis test result. But if the client tested somewhere else, we're able to like connect the two and let them know, oh, you don't need treatment, instead of receiving it, unnecessary treatment, when really the bit could have went to another person.
Okay, and final question. Well, not really a question. I'm not going to ask you to speak to college students for a second. We as college students live in a bubble. How would you make them realize that this is a real world problem, and what would your message to them be? Keyari?
Again, just I think educate yourself and take on some type of responsibility at the end of the day. I mean, you are in college, but granted, do you want to graduate, or, you know, not to just to be real about it, or do you want to actually cause potential harm to yourself and maybe not even live to see the day you graduate, because syphilis can cause death as well. So I think it's just when you understand the severity of this, or any STI, and what it could potentially do to your body, as well as introducing medication, drugs to your body. I think once you really think about that, it really, for me, I know he said letting go of fear, but that itself puts a little fear in me. It's like, well, I don't want to have to experience that, but it happens. And so once it does, you have to be responsible, go to a clinic, get tested, make sure your partners, at least if not inform the partners. One big thing that we do, we have anonymous partner contacting services. So basically we reach out to the clients, and it's the original patient's confidentiality is just kept anonymous. So that's one tool we use to actually reach out to sexual partners too.
Okay.
I would say when you graduate, just keep learning. You know, keep educating yourself. Volunteer at the LA LGBT Center or at AHF. Do the AIDS life cycle. You ride your bike from San Francisco to LA. You will hear a million stories about people with HIV or with STDs that need help and need awareness and you know, funding and that kind of thing. So I would say just keep educating yourself. Don't stop when you get that diploma.
Well, that's all the time we have. I would like to thank both of you for being here.
Thank you.
Thank you.
Thank you for watching On Point. For more information on syphilis and any STDs, you can visit the AIDS Healthcare Foundation website. You can follow us on social media at CSUN On Point. You can hear us on KCSN 88.5 FM on Sunday mornings at 5:30. You can watch us on Santa Clarita Valley Television on Sundays at 5 and on LA 36 at 8:30 Friday mornings. For all of us here on Point, I'm Shawandi Herrera.